The two items that we had on the agenda was the civic kitchen, and then we also want to talk a little about directors' issues, right?
COVID-19.
COVID-19, yep. So why don't we start with the civic kitchen? Basically, just to recap, they had requested a variance to have food storage in a refrigerated trailer. We had some inspections that didn't go so well, and we wanted to just bring it before the board again because we tend to only like to give variances when things are working smoothly. When things aren't going smoothly, variances have a way of escalating problems. So that's what we're here tonight to talk about. Anything else you want to add?
Yes.
Okay.
So during our variance meeting, it was stated clearly that you needed to have inspections prior to opening, and also have the service master invoices sent to us. So
I don't have an invoice, I can't give you. I had
So-
requested it and they didn't give it to me.
so the meeting was on 4/25, and you opened sometime prior to 5/2 without notification to our office. So you didn't follow any of the guidelines we put forth.
My apologies, I was totally under the impression that once I got the approval from the board that I was set to open, as long as the building department also signed off, which they did. So that was my misunderstanding.
And then the only reason why we found out that you were open was because we found that received a complaint about the deplorable condition that was left in. And Ray has more to speak about that.
Okay,
So
so,
can I just interrupt for 1 second? You do have the invoice here,
I
correct?
do.
And if you'll notice, the date to which was sent to me was sent to your office, I believe, within hours.
Okay, so it was sent to us on 5/9. So it was sent to you on 5/9, is that what you're saying?
Correct.
It's just that you also, I think our biggest concern is that you did open without the inspections.
I guess I'll ask the board, what was your impression as to when I could open?
you know, I'll speak first, I guess.
Sure.
There were, what I had heard was you had to have sign off from multiple different groups, and I had heard that the Board of Health was one of the, not the health department was one of the groups that had to do a sign off before opening. That's, you know,
So
do I remember?
And that's what I heard, but being, the Board of Health being at that meeting when it was signed off, that to me was, okay, Board of Health checked off, and then I was told you had to go to the building department and talk to them and make sure they signed off, and that's what I did the next day.
I think it'd be more clear, we do have a recording of it, and also it's in our minutes, so if you wanna just, if you wanna know that that was said, that's fine as well. You can absolutely listen to that.
Yeah, my recollection is not 100% clear one way or the other, and I tend to rely on our director to make sure that what we've decided actually gets done. But
You can see
I'm
the
not willing to.
confusion, right?
Yeah, absolutely. So
That's the point I
so-
want to make.
the paperwork that is still outstanding is that we haven't done an inspection yet, or we've done an inspection that's now good?
No, we have done the inspection, and we
Okay.
did give him the okay to continue.
Okay. And the other paperwork, you said that invoice, that was
We
an
received
invoice
invoice
for?
and the pest control
The pest
contract that
control,
we
okay.
requested because of the squalor, but I think the other reason why you wanted him here is because of the conditions the kitchen is left in.
Yeah, and so this is particularly important that when, at the end of the shift, people don't leave until it's clean. I know that everyone's anxious to get out of there, and it's like, well, we're coming in the morning, or the cleaning company's coming in right after we're done. But if they don't, then we end up with a big mess that.
Totally understand. Not that I'm making excuses, but I want you to hear my story as to
Please,
why.
yeah, no, this is an opportunity for you
Yep, yeah.
to speak.
The gentleman that cleans my building, he's been with me for 7 years. He started as a dishwasher 7 years ago, worked his way up left, started his own cleaning business and got another job. So this is basically his second job. Has a family, has a young child with some medical issues. He ran into some issues where he couldn't get there as quickly as I'd like him. I'm not gonna lie, I screamed at him, I yelled at him, but it's like, you know, he before we opened, he would get the job done, he'd do a pretty good job, did a very good job getting the building clean. So it was a difficult situation for me, seeing the situation he was in, but regardless of that,
Yeah. So just to interrupt, so this is our other board member, Melissa,
Sure.
we can hear you, can you hear us?
I can, sorry for the delay.
Yep,
Thank you.
we're talking about the civic kitchen right now.
Thank you.
If I may,
Please, do we have to?
I move
formally-
we permit remote participation.
Okay, I second that. All in favor? Okay, welcome aboard. Please continue.
So like I was saying, you know, he was under some stress, hard-working kid, second job, working 1,000,000 hours a week, and I'm trying to tell him, listen, it's not too long before I get in real trouble here, and so back and forth, and unfortunately, he couldn't do it, and I had to let him go. But again, it's a guy that's working for me for 7 years, who does a good job, he was late a few times, I'm not gonna lie. But it's a tough thing for me to have to go to a guy and say, hey, you're fired, because of this. So I want you to understand, I don't take these situations lightly. I've been doing this a long time. I've never been in trouble with the Board of Health in my life. I find this embarrassing, to be quite frank with you guys. So just understand that I take these situations very seriously. That was a unique situation for myself, but he has been terminated. And a new company started, and they start as soon as we close.
Today?
No,
Oh.
they started,
Oh,
this was,
a
when I got that, the letter,
Okay.
I said that unfortunately now's the time.
Okay.
Did you want to add?
Well, no, I was just gonna, we just went back through and found other, dates that we had had issues with. One was May 3rd of last year, we went in, there was a water leak in the kitchen, and there was grease underneath in the crawl space underneath the kitchen. When we went in to check the crawl space and everything, we went upstairs and we noticed the kitchen was a mess then. We had talked to the manager there, he said he would take care of it. Jim was on site, Jim who works for the town was on site for the next 2 to 3 weeks and never saw another issue. Then 2/16 of this year, we received a text from Jim, he was in there working on something else, had to go in the kitchen, noticed the food, called us. They weren't opening until 4 in the afternoon,
Notice the food.
all over the floor, we have pictures.
Oh, you're talking, the kitchen was.
The kitchen, yeah, the kitchen wasn't clean, yeah, the food there was piles of lettuce and stuff like that on the floor. So he had contacted me, at that time, you weren't opening until 4 in the afternoon, because of the pandemic and everything like that, so, and there was staffing, they were opening at 4, so we didn't go until 1:30, by the time we got there at 1:30, the floor was clean. But, Maria did her regular inspection, we spoke to the manager on duty that day was Mike.
Correct.
And I knew that they were closed Tuesdays, Monday and Tuesdays, so I said, how can you leave this for 48 hours? Oh, we were open the 14th. Monday was Valentine's Day, so we actually opened on Monday instead of staying closed, so it's only been 24 hours. I said, I understand, but it shouldn't be, I thought it was 2 days, it was actually only 1 day, but still 1 day was too long for food to be there. And then Mike stated he would speak to Tom, and they would figure something out. And then the same thing, Jim went in again for a few weeks, was doing work around the building like he normally does. Danny, who works for the town, been in there and there was no issues. And then on the 2nd of this month, facility had reopened after the emergency closure, and we received a call from Jim Stewart, who was on property, doing an estimate in the basement. They had to go in the kitchen again, he noticed the mess in the kitchen, and contacted us again. Maria and I went up right away, he said, there's a manager here, so the marketing manager was there. So we went, spoke with him, he said, I'm not really the food guy, he says, but whatever you tell me, I'm gonna pass on. So Maria did a report there, and Tom has gotten all these reports. So that's more or less it. So the codes, we always like to give the codes that were violated. The cleaning frequency, physical facilities shall be cleaned as often as necessary, keep them clean. Controlling pests, premises shall be maintained free of insects and pests. Their presence shall be controlled to eliminate their presence on the premises by eliminating harborage. That's the state wording, not mine.
Yeah.
Harborage is defined as having the ability to obtain sustenance, food and water, and the ability to nest. So with the food on the floor and moisture in product, that's food and water for the pests. Maintaining premises, unnecessary items and litter. Premises shall be free of litter. That's the food on the floor in the kitchen. And then frequency of removal, refuse, recyclables, returnables shall be removed from the premises at a frequency that will minimize the development of objectionable odors and other conditions that attract or harbor insects and rodents. So those are the 5 violations that would be because of the kitchen being left overnight for multiple hours. Because if they close at 10 at night, they leave by 10:30, 11. If the cleaning company, we get there at 7, that means it's been 8 hours of nobody in there. And we did speak with, let me see, the marketing manager on the 2nd. Maria and I would explain that right now, I don't know if you know or if you've noticed it in your houses, I've talked to pest control, a lot of issues with mice this year. I'm getting complaints that we've never gotten complaints. New houses, old houses, apartment complexes, restaurants, stuff like that with mice issues. Because of the weather and everything, it's really, and I talked to pest control, and they said it's a really bad year. So we explained to the manager, we don't want to see anything get in here, because once it gets in, it's tough to get out. So those are the kinds of points we made. And that is it. I'm going off, Marie couldn't be here tonight, so I'm going off of her inspection reports and our notes. Any questions?
So I just want to summarize what I'm hearing and just tell me if I'm getting this correct.
Mm-hmm.
That you're saying over more or less the past year, there's a pattern of there being a problem, the problem gets identified, it's corrected, and things are good for a while, and then problems occur again. Is that a fair representation of
Yeah,
what
I mean,
you're
in
reporting?
the 3 or 4 instances, yes. Because like I said, Jim is up there probably once or twice a week if there's issues, more, and he notifies us because he has to.
Yeah.
And I would tell, he said, oh, I'm gonna be going back in the next couple of weeks. I said, well, just let me know. And he'd tell me everything was fine, it was clean, it was perfect. You know, he tells me when it's dirty, he tells me when it's clean, so it's not like he's picking on anything, so. But yeah, that's how it would go really well. You know, I mean, it was last May, and then we didn't have anything again until February, and then it's been May. So it was a long period of time, short period of time, but that's kind of what's been going on.
Yeah, so I mean, I think from my point of view, what we like to see is the attitude of, we're gonna fix this is not appropriate. You know, when we get people in, they're like, oh yeah, you know, it's not that bad. That tends to rub us the wrong way when people acknowledge that, you know.
But you understand
we do,
my
absolutely.
position
Yeah, no,
and who I was dealing with, right?
I'm in many ways agreeing with what you're saying. I think that we do have high standards in town, and we do want everyone to you know, meet, if not exceed those standards. I don't think our standards exceed the state food code, but we actually enforce to the state food code. So for me, the decision is about whether this represents something where we have to take any sort of action, whether it's, you know, pulling the variance or doing some change like that, or whether we think that you're going to be able to keep it under control. And it's a little bit of a judgment call from the board, I think, in terms of, you know, how each of us individually, you know, are assessing the situation. I don't know if you've got more to add, Melissa, or any other questions you might have missed a little bit at the beginning. Oh, we've got something too, Jen.
Yeah, I'm sorry if I missed it at the beginning, but, so the plan in place for, you know, cleanup so that it's not going overnight until the next day?
We have a brand new crew in, they actually work there, and if they're not working, they come back, and they, like I said, there's no gap.
So, as soon as you're done with your service, someone's there to clean. And
Correct.
it's not, the property's not left until it's clean?
Correct.
Okay.
Correct.
That was my question.
Yeah, no, and I think that sounds exactly what we would like to have happen in this situation. Do you have any other thoughts or comments you want to add?
I don't think so, but I just want to get clarification about, because I missed quite what you were saying in terms of, you know, not leaving till things are clean. What is exactly the protocol that you've got set up going forward?
Currently, right now,
Yep.
I have people that work for me currently, they're the new cleaning company, they're gonna start cleaning. So when they're done work, kitchen shuts down, no customers in the restaurant, that's when they start cleaning.
Okay.
So there's no gap, there's no, you know, wait a few hours, or they'll come in the morning.
And to the point though, I mean, so I hear you say they work for you. What if they're not there?
They come back, so there's 3 of them. So if, they all know that it's gotta get done. So there's 3 people that have been picked to be the new cleaning crew. So usually 3 are gonna do it, but if 2 are there, 2 do it. If 1's there, 1 does it.
Mm-hmm.
So there's no, that's why I did what I did.
So I guess my question, when do they show up? Maybe that'll make it clearer. I mean,
10 in the morning,
so
12 in the morning.
they're there 10 in the morning, 12 in the morning. What time do you serve food?
Till 9.
And so they're there at 10 in the morning, and then at 9 o'clock at night they start cleaning?
Correct.
I'm not sure that sounds great to me, in that those are very long days for people.
How many days do they do that?
6.
They're open.
That's a lot.
I mean.
Now you guys are dictating when my people
No,
can work?
I don't think.
We're trying to assess what their
Can
plan
I-
is realistic.
Can I ask a question?
Sure.
I mean, you're talking, the people who are cleaning are the people who are your staff working for you.
Correct. Honestly, we're already pegged it out, it's another
Yeah.
hour, maybe hour and a half, if there's 3 of them. Now, if only 2 of them, then it's a little bit longer, but it's an additional,
I
6
think,
hours a week.
I think what the understanding and the misunderstandings is, they don't all work all 6 days. One may work 4 days, one may make, so they work in 4 11-hour days, one may make 5.
I mean,
Well, no, I'm
you
just
know the
saying.
restaurant business,
Schedule
that's
the
it.
schedule, yeah.
No, I'm just saying, they don't all work 6 days, 12-hour days.
Sometimes they
Some they
do.
do,
This
okay.
time of year when it's busy, they do.
Okay, that's what I was trying, because I know people fluctuate. I may work 4 days and they overlap on somebody else's, but I was just trying to figure that out. But I think they're worried about people being tired at the end of the night and not doing a good job.
Have Jim come in.
Okay.
Jim will monitor.
I was
Okay.
gonna suggest that.
Yeah.
I don't know if you wanted to discuss with probation or those are your other options, just letting you know.
Yeah, I think that if we go down the road of probation, which entails an extra set of inspections, and I think a little bit of cost too as well in terms of, those extra inspections. We don't really like to be doing both probation and variances. People that are on probation, we really don't like to do that. At this point, unless somebody else on the board wants to put them on probation, I'm not looking necessarily to put them on probation. Okay. I do think that working closely with Jen, Board of Health, if she is saying that certain paperwork is missing or needs to be, updated or complied with, that's pretty serious. Even if you've already done the, let's say pest reports, whatever, and she just needs it for the log, that is important.
Again,
You only have what you have, I know.
if I, say, listen, I need that paperwork, Board of Health needs it. Like, I did the same thing with my pest company. The guy came in the afternoon to do it, and it's 5, he's not,
Yeah, he's out of work, yeah.
He emailed me at 10 o'clock in the morning, at night, because I needed it. This company didn't do that.
Yep.
I mean, I don't know how you want me to control that.
Nope, I mean, this is part of running a business, is to make sure that you meet all the rules. We certainly understand that you only have so much control over the people that are subcontracting for you. We also, from our point of view, just want to make sure that
Understood.
things aren't, not getting done, and there's no paperwork, and we don't really know, and so it's the paperwork to us that kind of proves that it was done. And that's why we're focusing a little bit on that.
And if you could follow up with Christie also, I did forward a copy to her. My insurance company isn't paying for it, it's a $4,200 bill. And speaking with my insurance company, they did mention that I should be on the onus. The onus of the cleanup is on the building owners. So if you could follow up with her, again, emailed her and I haven't heard back.
Yeah, unfortunately, we can't get involved with that, but I will tell her that you
Okay.
reached out. How's that? Is that
Perfect.
So I don't know, do either of you have concerns about the Civic continuing to operate after hearing, what's been discussed?
I don't have concerns. I would say, when in doubt, err on the side of over-communicating with the staff. And obviously, where I articulated what I was hearing before about there being sort of relapses of problems, we want that to stop. And hopefully this new plan will do what you want it to do, but, that's on you and your crew.
100%.
Yeah.
And if you know that it's not going to happen, you just let us communicate.
The most important thing in business is communication. Now, you going in, Maria talking to my managers, they're communicating with them, then they communicate with me, and a lot of things can get lost in translation. In the future, you guys have my cell phone number. Can you call me directly and say, hey, this is the problem?
Yeah, that's not usually protocol. We talk to the person in charge on site, and that's what we're
I mean,
required
this
to
is a
do, but
different-
I mean, we can
We
certainly
can,
look at
because
that.
we do have the reports, and the reports do go to you, so that they will get emailed to you or whatever, so we do have, the reports have all been seen. It just is, and I understand what you're saying, and as
Is
a
it
previous-
possible for the person in charge, who probably also has your cell phone number, to, you know, as soon as there's any sort of issue, to just dial you, and then at least you're present
I will
during that
make that-
conversation?
I'll absolutely ask, I'll request that, but it's going back to, that's somebody else. I'm relying on someone else to get
You
a
are,
hold of,
it's
you know.
the person that is labeled the person in charge, right?
Yeah.
And so, if you can't rely on the person in charge,
Well,
then
believe me.
maybe I've got to second guess where I'm leaning right now. Because you have to be able to rely on the person in charge.
Because under the federal food code, it says it's supposed to be someone in charge at all times, and that's, so we have to deal with the person on site.
Okay.
So I understand what you're saying, yeah. I might say when I do inspection, you might wanna call Tom. That's as far as I can go. I can't overstep that,
Got it.
cause then,
Can you email me right away then? Is that?
Well, you get that email, the food permit emailed to you. That's-
the report,
yeah,
report.
Yeah.
That's what it
because
is.
what I'm saying is,
Food report.
if every time I go in there, I call you, your manager's gonna say, well, why am I here? So I gotta give them the opportunity to contact you.
Again, this is just a unique situation,
No, I
and
understand.
again, I don't wanna be here ever again.
Yeah.
And I don't wanna, and
We don't wanna see you ever again.
And I wanna make sure I'm doing everything the
Yeah.
way it should be done.
Mhm. If there's something really, really bad, I would be like, on a regular report, you're gonna get a copy of that report. If it's nothing, if it's something like this, yeah, I would sit there with the marketing manager, I'm sorry, I don't know his name. I would say, call Tom now while we're here, or something like
Perfect.
that. I think that's better, but a regular
Perfect.
inspection,
Perfect.
I'm not gonna contact you on that.
Anything out of the ordinary, how's
Yeah.
that? Because we can't, obviously, there's so many
I get it, no,
establishments.
I get it.
So I don't think there's anything then action to take with
Yep.
the Civic with the Board of Health. So I
What-
think that we've heard,
I have a
oh, you've
question.
got a question.
You mentioned, having Jim check on it.
No,
Do you-
I-
oh, no, Tom had said,
mentioned
okay.
it.
I didn't know, is if you want us to do any, like, in a couple weeks, just swing by in the morning or something
So-
to do some checkups, or you want me to just wait till the next inspection?
Refresh me, who is this person?
Jim is the buildings and grounds, well, not director anymore, he's in charge of all the town buildings.
And we obviously own the building that.
Yeah, the town owns that building, so he goes in there for repairs and for different things, so that's when he notices, stuff like that.
my feeling is if it was a different situation, then I would want you to do a
Okay.
follow-up. But because someone from the town is going there on a regular basis, frequently, that makes that unnecessary.
Okay, I just wanted to double check to make sure I'm doing what I need to be doing.
Yeah, no, I don't think we need any special visit by him, but again, if you guys are in communication, that's a good thing, and so if he happens to let you know that something's going on, we shouldn't have him stop doing that.
No problem.
Okay.
Okay, thank you, appreciate you coming in, good luck.
Thank you.
Thanks, Tom, thank you.
And so we do have somebody here from the community advocate who, she said she might take pictures, I don't know if you're against that, I didn't have
I'm not
a
against
problem
that,
with
but I actually think we have about a 1-minute break.
Yep,
I just want to go to my car and get something to drink.
That's fine. we're gonna recess for a minute.
It is warm in here. It is.
It's actually cool compared to my car, my car was hot today.
Yeah.
That's because you wind it up enough to get the air conditioner
Do
running.
you know when your car is coming yet?
It's supposed to be July to September.
The waiting starts.
Yeah.
Do you have a picture of it?
Not on me,
No.
but I did get they said they have an actual VIN number that's assigned to me, so
Nice.
that's good.
When did you order it?
August.
Almost a year.
Yeah, it's an electric car, so
Wait, what kind of car?
it's a Volkswagen, the ID4.
Which one? The,
It's an ID4.
It's an electric car.
yeah, no, we were looking at that.
Coming off the plant.
Uh-huh.
What made you
We were
decide?
looking at the Audi electric, and the wait was so long.
Yeah.
When made you decide between all of them? That one.
So for me,
I can't hear, like,
Jen.
for the next part of the meeting, the other side of the room very well.
Okay.
Like Jen, I can barely hear. So I don't know if there's like a mic that can be moved a little bit, but.
nope, but I can try to,
I'll speak louder.
yeah, or I'll try to re-say what you said. Jen said she's gonna speak louder.
Okey doke, thank you.
Yeah, what did you decide on that one? For me, I was looking at the Ford and the Mustang E and,
That is
and
nice.
one. And at the time, the Ford was saying that their waits were gonna be really, really long, and Volkswagen was like, oh yeah, we think we could be able to get it to you soon.
That's a lot right there, right?
Yeah, I know, so they both probably had long waits, it's just what one told me.
Can I make
Okay.
when you open up, can I make an announcement before we continue with COVID?
Yes,
Thank
so why don't we resume session,
Yep, yep.
and,
So I am so sad to say, but I'm so excited for Paula that she is officially retiring.
No, she isn't.
Yeah.
Who told you that?
I know. I wish it wasn't true.
I don't think you had 3 people sign up on it.
Yeah.
I would know. Her last day is August 31st, and you know she's such an important part of the team. It will definitely be hard to see her go.
It was a hard decision to make.
Yeah. So that means that we have to start posting and looking and,
Mhm.
okay.
Christy's aware. We've been discussing it. Paul and I have been reviewing, and the whole staff has been reviewing her job description.
See if we can steal somebody good from some other department.
That's how we got Paula.
I know.
I don't see there being another Paula.
So with that, anything else, or shall we move on to?
We can move on.
Okay. You want to
Sure.
introduce, and Jen, I don't, should we move this closer to you while we're talking? That way she can at least hear you better.
Hi. All right, so I have a COVID report breakdown of our current numbers with the schools as well. So currently this week, from 5/9 to 5/12, there are 43 positive PCR antigen cases in Maven. Out of those, there's 6 congregate care, 13 household spreads. Last week, using the same time parameters as the Board of Health office, we used Monday through Sunday. So during the week of 5/2 to 5/5, there were 53 positive cases, PCR antigen in Maven. So we are 10 less at this current state right now than we were last week. And then 5/2 to 5/8, there's 69 positive, this is the whole week, the 69 positive PCR antigen cases in Maven. Out of those, 18 congregate care and 16 household spread. So this week, using the same time parameters as the school, Friday through today, this is the latest numbers for the town. There's from 5/6 to 5/12, 73 positive PCR antigen cases in Maven. And in the school currently, there's 106 positive cases. Of these, I'm sorry, it's 109, not 106. Of these 109 cases, 27 children are reported in Maven, so they are out of that 73. The school counts from 5/6 to 5/12. For Mill Pond, there's 46. For Fales, there's 33. The high school has 13. Gibbons has 9. Armstrong 5. Hastings 2. And pre-K has 1. As you know, just a reminder, current masking guidance, MDPH, masking guidance has not changed since you voted to adopt, and the DESI masking guidance for the schools has not changed either. And then also, after a slight decrease, the COVID RNA samples in the wastewater from MWRA have now slightly increased in both the northern and southern water systems. So we may see a little bit more of an uptick. I don't know if you want to discuss the report before I go into reminders for the public, or if you want me to.
I mean, the other issue is hospitalizations have increased, and CDC issued guidance on red states, which Massachusetts, counties and states, which Worcester County was certainly one, recommending being red in the red zone, recommending indoor masking. Well, I hear, that our state and our schools haven't, I honestly don't know what the schools are doing. If there's anything that they're doing for mitigation, please, let me know. I know other schools and school systems, if there's more than one child in a classroom or 2 in a classroom, they're asking that classroom to mask type thing. Are our schools doing that at all?
No, I have yet to be able to speak to Amber on that. I know that notices have been going home regularly to the students regarding their class, if there's an uptick in the classroom.
Yeah, anecdotally, I've heard that in the classrooms, there's a fair number of people that are missing each day and presumed to have.
I'm sorry, can you speak up? a
Yeah,
bit?
sorry, I was saying that anecdotally, I've heard that there are large numbers of students that are missing from school. And the kids at least are presuming that it's COVID related. And so that would be in line with, you know, some of these, 109 cases in the schools. So it's definitely there and, you know, being passed around. I don't know if it's being passed around at the school, but it's being passed around in the community at least.
So, I have a question, which is there any routine testing going on right now, or this is all people doing testing on their own and then reporting to these schools?
I think it's both. I know that if they come down and they are symptomatic and they believe it could be incomplete testing.
Well,
But
so,
it's also self-reporting.
right, but I guess what I'm saying is, it's obvious if someone's symptomatic, sure, get tested, but what I'm saying, is this like contacts? Like if a student in the classroom is positive, other kids are getting tested?
No.
No,
It's no longer happening.
No.
okay.
There's no contact tracing.
No, I understand, I wasn't asking about formal contact tracing, just, you know, whether, you know, whether there was any policy within the school of anyone in the classroom, you know, go ahead and get tested if you've been exposed.
And so they,
Oh, I also want to
Oh.
say that 98 of the students of the 109 are fully vaccinated. Just to
Okay.
be clear, I don't think I stated that.
yep. I think that's pretty much in line with our high vaccination rate. I would
Yeah.
expect most of them to have been vaccinated.
So what strikes me about this report, and I don't know how similar this is to the weeks previous, is, you know, the high school, 13 cases in the high school, that's sort of like, okay, whatever. But you look at Mill Pond and Fales, and that's like where the problem is. So either there's some kind of, what they're doing there is facilitating spread in some way. I mean, because you have Hastings and Armstrong, which are younger grades, so it's not a question of like little kids who, you know, are all over each other. It's this middle window that seems to be particularly bad. I guess Fales is the same as Hastings and Armstrong.
I know that a kindergarten class had a widespread in one classroom, and I also believe it was another fourth grade class that also was a widespread in that classroom.
Okay.
I think the difference with like a school like, you know, the elementary schools in Mill Pond is a lot of those kids are together all of the time versus obviously the high school and middle school, where kids are bouncing around, you know.
Although in many ways,
Yeah.
I would think that would make it worse, right? In the sense of if you've got classes with different people every single class, then you're more likely to be spreading it than if you're just with the same people, because then it would be like the kindergarten class contained to just that one class.
Well, but you're more likely if you're with those people all the time, all day long. I would think that it's
Yeah.
higher risk if, you know, if you're in the same classroom with the same kids all day long, non-masked, you know, there's definitely gonna be a higher chance that they're gonna be spread.
Yeah.
It's just, you know, I mean, obviously, these can only be our recommendations. We're not making decisions for the school unless we're, you know, gonna mask the town again. But it just seems like it would be nice if they're having these conversations. It's a lot of numbers, you know, that have happened in the past few weeks. I personally, with how the numbers are in Massachusetts and in our county, think we should have an indoor advisory, because we don't have one currently. But that's my recommendation, that we change our current non-advisory to an indoor advisory.
And Jen, you said you had some additional stuff to talk about as well before we make a decision on advisories?
This was just a reminder to the public of what's, just some announcements.
Okay. Do you want to do that first, or do you want to do that
I
after?
think it wouldn't make sense to do it
Okay.
right now.
I'm also concerned that the number of cases are going up. I think that hospitalizations are also starting to tick up. It's not rising to my threshold of wanting a mandate at this point, but I might not be opposed to putting out another advisory that people should be masked indoors, especially in cases where we think there might be higher risk. I mean, in a school like Mill Pond that only has a few grades and having 46 kids testing positive seems like very different than, the high school with 13 kids in 4 grades, So there's, and that's, we have more detailed data for the schools, but the same is true for the community as a whole, right? If there's cases going on in particular certain situations that we don't have the data for, people are gonna have to make their own decision about how safe it is, and without accurate data, do we want to err on the side of recommending that people wear masks? Or do we want to, wait until it gets potentially worse?
Yeah, I just want to, in some of our, when Jen had said we had some that were in congregate care,
Yep.
most of the congregate care are still considered medical, and they have to wear masks inside, and then they spread with the masks, just to let you know. So there is some spread there.
The other concerning thing that I've been hearing, and it's, again, been mostly anecdotes, is there's a lot of people that are testing negative with the antigen tests. And then when they go and they get a PCR test, they're like, oh, I knew I had COVID, I have all the symptoms. And even if they've tested 3 different times with 2 brands, they're still testing negative on the antigen test.
We do see that as well.
Yes.
Not often, but it definitely we have seen
It does
that.
happen, yeah. So this, I think, is gonna further dampen our ability to understand what's going on, because there's gonna be people that are, I just tested negative, I'm fine, I can go to this event. And I don't know if we need to convey a little bit more strongly to the community that while a negative PCR test or a negative antigen test is, nice, it doesn't love that you might still have COVID.
Yeah. So in my practice, I definitely urge people to do more than one antigen test, even with symptoms, with seeing, initial or antigen test being negative. So even if you have symptoms early on, then the people with no symptoms or just screening, definitely, it's just not as good of a test for that reason. Obviously, it's better than nothing, when people are wanting to do something to be safe, so it's a good thing to do. But yeah, in my practice, if people have symptoms, I am recommending they do at least 2 antigen tests. And yeah, so. Which is what the box says that too. So.
That's something we do also state in the health department, that if you continuously are symptomatic, continuously
Yeah.
test.
And do you still have antigen tests available at Board of Health?
Yeah.
Yeah.
Yeah, so that email was great.
Yeah.
That went out. That was great.
Thanks.
You have comments or thoughts?
I have some thoughts. They're not as well formed as I would like them to be, but I do tend to focus on, in my opinion, what really matters, which is hospitalization and deaths. And certainly, when I think about the fact that there are all these cases continuing to happen, that's not good. People who get COVID, even if you've been vaccinated, you can be pretty miserable. No question about that. But I'm not sure I want to change the level of our guidance from the guidance to, that's what, I think right now it's
Right.
guidance and raising it to an advisory if I don't see evidence of a significant increase in hospitalization.
And there have been.
There's been
There have
some.
been. I was just looking up the numbers.
Yeah. I haven't looked at them in the last couple of days, so you may have better, more timely data that you've looked at.
But even without hospitalizations,
Yeah.
there's that gray area between, let's say, missing 5 days of work because you can't focus, right? And needing to go to an emergency room, right? And that if everybody in town was missing 5 days of work, right, that's pretty serious, right? So even if the symptoms are not necessarily hospitalization, you need to be on a ventilator.
Yeah.
When the number of cases is fairly large, it gets magnified by that risk level. And so even something that was a smaller outcome, when you have enough cases, it does make it more significant. And so whether we're at that point or not is, I think, what we're discussing. But I wouldn't just say we're only going to go by hospitalization data, because there's a lot of people that are feeling miserable that do not go to the hospital.
Sure.
And it doesn't mean that they're asymptomatic or that they're not suffering, at least for a time period.
No, yeah, you get that.
The hospitalizations are up to 728. The last time I had looked, I think they were in the 400s. So, I mean, there's definitely been a really significant uptick this week. And yeah, like for example, just getting another number here, May 2nd, 534. So it's just climbing. Of course, they do have the breakdown now, people who are in the hospital specifically for COVID versus the people who
Found out,
are in there and they were also found to have COVID, which is helpful too. I mean, yes, we're not seeing an increase in deaths yet, which is good. I think there is concern that there's still, with just the number of cases, that could go up again, but.
Well, we certainly have better treatments now than we did a year ago.
Yeah.
And multiple options for treatments, but
Definitely.
they're not, they're not perfect either. We know that.
No, and I think they work best if you find out sooner, and if some of the tests aren't working showing you as positive the first time, it's certainly delaying any sort of treatment options you might have.
Yeah.
I don't know, my feeling is that having something to indicate to the public that things are getting worse now than they were a month or 2 months ago is appropriate. Because I do think that, I was hoping that the summer was going to be completely flat.
Yeah.
And it's not. In fact, it's, depending on what metric you're using, I mean, it's still here.
Well, it's also not the summer yet in the sense of this was a pretty cold spring and people have still been indoors mostly. So I guess the question would be if we go to an advisory.
What conditions do we want on that?
And what exactly are we saying? We advise use of masks in indoor spaces. Do we say anything different than that? What are you suggesting? Or you meaning either Melissa or you, Nathan?
Do you have something specific, Melissa, that you were thinking?
I mean, certainly crowded spaces are worse. I just think in general, indoor masking in public spaces is a good advisory. So, for now.
I think, I do think, it's easy for me to buy into it if you say crowded indoor spaces. I mean, there's sometimes you go into indoor spaces and
You're 6 feet apart.
forget about 6 feet apart. There's three, you
Three
go into the
people
grocery store at 10 o'clock at night, and given the volume of that space and the number of people who are there being told, please bring your food to the checkout line, I'm less concerned about that than I am if you're talking about, let's say, a high school play or something like that, where it is crowded for a prolonged period of time, and I think you're going to get much greater risk in a situation like that.
I mean, I just think it gets confusing when you break it down. This virus is so contagious. The whole spacing thing I think is somewhat out the window, but obviously I hear what you're saying. You're in a grocery store with 10 other people. I get it. I just think just to not confuse people.
To me,
An indoor masking guidance. That's what the CDC, they have all their numbers and their breakdowns and state by state, and that is currently where we fall, based on their numbers.
So from my perspective, you have to, I agree with you, a more nuanced message is more confusing. I 100% agree with that. But I also think it has more credibility in that one of the problems that we as a public health community have had is there are people who think this guidance isn't backed up by anything that they view as valid or whatever. And if it seems like our description of the risk is a significant mismatch from people's perceptions, it undermines our credibility, whether that's right or that's wrong. And particularly with things that are what I'll call blanket guidance. And to the extent that we do introduce a little bit of nuance into it, I think it strengthens the likelihood that people pay attention.
Well, I mean, CDC is recommending, so I'm not saying, I wouldn't say that there's nothing backing it. But I mean, if we're gonna have wording other than just the blanket guidance indoor masking advisory, we certainly could say after that, especially in places that are crowded or where, physical distancing cannot be maintained.
To phrase it like
I
that.
I would be for that, all for that too.
To phrase it like that, though, invites people to wonder if I'm in an indoor space by myself, is the Board of Health recommending that I wear a mask?
No, I just said especially in places that are crowded where social distancing cannot be done.
Right, so you're recommending it everywhere, and then you're especially recommending it in those crowded places.
Yeah.
That's still recommending it even when you're alone in a building, which I think is more of what Dr. Ehrlich is saying, is that if it's that we're recommending it in crowded indoor spaces.
Okay, for example, let's say for example, two people are in a grocery store and they're in line, one behind the other, and one is coughing. I mean, so I get what you're saying. It just, to me, it seems like the responsible thing to do with the current numbers. These numbers are higher than we've seen. I mean, it could be the highest we've seen. I don't know, Jen, since when? It's very high.
Well, probably since February. February was when it peaked.
Were we even this high in January, February?
Yeah, we
Yeah,
were well
we
over
were.
100 cases a week.
Yeah.
We were, okay.
Yeah, I think we put the mandate in around 100, right?
And we went up to about 160, 150, 160 cases a week at the worst of it.
Okay.
Again, I want to make clear, Melissa, I'm not saying that your statements aren't backed up by anything, okay? I'm saying that is a perception that is out there amongst the public at times when they perceive a mismatch from what seems like the risk versus the guidance.
Yeah.
So if we, go ahead.
I could definitely, if we're in agreement on a statement that says, where areas that are crowded or you cannot social distance, I would be okay with that too.
I'm okay with that.
Yeah, I think I am too. So let's have a motion then where we issue an advisory that says that.
I can make it a motion that we have a town advisory for indoor masking in public spaces that are crowded or where social distancing cannot happen.
And while we have discussion on this, in terms of the people at the health department, any comments from you guys on how this might be received or reacted to?
I'm going to probably guess it's not going to be well received.
You're saying you don't think it's going to be well received?
You think it's going to end up causing divisions in the town again and that sort of thing? Do you similarly think that same way?
Oh yeah, I've already, people know the numbers are going up. And people have already said, what's the town gonna do? I said, I don't know, the board hasn't made a decision. I hope they don't go to masking again. I can't deal with that again.
Yeah, but the difference, that's.
There's a big
I
difference.
think it is advisory.
Yeah. Well, no, I
I
understand.
hear a mandate, not a advisory.
No, I understand, but even advisory, people are gonna scoff at it. We're gonna get, people are tired of masks, and I'm just saying, whatever you guys say to do, I'm gonna do, so it doesn't affect me, but, it's just, I know we've already had people scoffing at it, because they see the numbers creeping up,
And they know what the guidance is already.
the guidance is already there, so they're getting nervous that, oh geez, the numbers are going up, the town's gonna do this again, so they're like preemptively upset before they even get upset.
Well, even better would be if some of those people were to preemptively take precautions to prevent the spread of the virus, and that way the numbers would actually not go up. I think that would be an ideal situation.
Yeah.
But I personally believe that the guidance has been out since February. People know exactly what the guidance is, and they should, if they feel at risk, they should be masking. And
Yeah.
that's, I mean,
And so, I largely agree with you, Jen. the way I perceive this, and again, I'm interested what how you guys think this would go over, how it would go over. But the way I perceive this is that the change from guidance to an advisory is one to let the public know that there is an uptick in the amount of COVID in the community at the moment. And if there's some other way of doing that, because I think people do look to the Board of Health to at least send a signal as to what's the risk level. And, I don't think the risk level is high enough for any kind of a mandate, in my opinion. But is the risk level higher than it's been recently? Yeah. And so how do we communicate that to the public? And I don't know if you have an opinion on that, but.
Well, I think we have been through our weekly reports that are on our website and through our Facebook page. I don't think I am not aware of people not knowing exactly where COVID stands right now. I think it's a lot, it's spoken about a lot throughout everyone, and I think people are aware already that the numbers are increasing.
There's no numbers on the website for May though.
There is from May 6th.
I'm just looking right now and I don't see any.
So when something is added to the website, depending on where you look, like if it's under news and announcements, that gets sorted by what comes first.
I'm just looking at the cases, the Board of Health cases, the last dashboard is April. Through April 30th?
No, we have one through May 6th. And then this Friday we'll have one for that.
Can someone look right now? I mean, I'm on the website right now, and there's nothing.
Well, we have this one. And we could-
The only computer we have that's open is the one you're talking on.
Actually, can you pull it up on your phone? I'm going on what town website. Yeah, I know Paula can just confirm that she has put it up there last Friday.
Okay, well, I mean, I'm just looking at our website right now.
Actually, didn't I send you the link? I believe I sent you the link because you couldn't find it and I sent you the link.
No, that was just the link for COVID tests that I asked for.
So,
But
go ahead.
Is it under our town, is it under news, or is it under our?
I'm looking at Board of Health confirmed cases in Westborough, at the top of the list.
Okay, I'm just.
That's Paula, do you remember where you put it?
I mean, I'm just telling you what I'm looking at right now.
Yeah.
I'm looking, I'm trying to figure out where we're looking, that's all.
Yeah. I can share my screen.
Transfer station.
Fire personnel, it's on the headquarters, 42 Oak Street, in the lobby for the Walk-in Medical. Time out, 18:25.
I mean, this does seem like it's hard to find. Yeah.
No, if you just go. The blue bars on the left side of the on our page,
So go to the blue bars on the left side of the page.
and then click on the one that says coronavirus, the first one.
COVID-19 coronavirus information and updates.
Yep,
Okay,
and that takes you to that page,
yep.
and then,
Okay, I see, it says it's posted on 5/6, but it's for the period through April 30th. That's what it said.
So that's what you were referring to as well,
I
Dan?
guess there's just a significant delay in the posting with this particular.
Well, we agreed to use,
oh, you know what?
the state,
Yeah.
well,
I got it.
It's under COVID-19.
It's just a little confusing because it says posted May 6th, but the numbers are only through April 30th, so it's like a week off. I get it. Sorry.
And I think Paula might have found some other link.
COVID-19 updates as of May 6th.
That's just the,
that's
well,
our
that's just the
The
announcement.
thing is that number kind of, if you look at that number right now, our
Yeah.
website now, but if you look at mass.gov.
Yeah, so if it's the 12th now, and the last day that we have is the 30th, and people are trying to figure out whether things have gotten worse or not, again, I would also lean that maybe we need to be a little more proactive in what we're, coming out with.
So my argument to that is
Yeah.
currently, we have 73 cases in Maine. Our biggest, one of our biggest, I think, your concerns are is the schools being so high, which is 109.
Yep.
So they post that actual number and each school on their website. So the information is out there. Yeah, I did, I confirmed with Amber and Judy that they are doing it weekly.
Still doing that?
Yep.
It seems to have moved. But that's, I'll find.
So I think doing something to indicate that the situation today is a little bit worse than it was a month ago, in my mind makes sense. I think that for those people with different risk tolerances that want to look at this to decide whether they're going to take some action or not, realizing that we've shifted a little bit is good. So I think I'm in favor of the motion as we have it proposed. I don't know if you have more comments, or Melissa, you've got more comments about this?
No, I mean, I think our current, what do we have, our current guidance for people who are at higher risk to mask indoors, is that what we currently have?
Yes.
Yes.
Okay.
And so this
And
advisory
I
would
think,
broaden
I
the
think
scope.
that certainly should still stand, whether we change that from a guidance to an advisory. And then I guess we would add the indoor masking guidance and, crowded areas.
So, from a practical level, in terms of how anything in town operates, this isn't going to change anything. Is that correct, Jen? This is basically just us saying
What your
that COVID's
advice.
up a little stronger than we had before.
Yeah, I think that's our goals. We're not telling people that they have to take some action, but it's so that their own individual risk tolerance can use knowledge from the Board of Health in shaping their actions. So do we have a second for that motion? You get more comments?
So, the motion was that the Board of Health provide an advisory,
Crowded indoor spaces.
crowded indoor space, go ahead,
You
Paul.
can't social distance.
Yeah, I would add to that, and you can tell me if you approve of this as a second sentence, related to what we're saying. We recommend each person assess their level of risk tolerance and act accordingly. Or maybe, no, I'll say that, I'll rephrase that. We recommend each person assess their risk tolerance in light of the current level of infection in the community.
So are you saying that not everyone you're not advising everyone to wear a mask? 'Cause that's what it sounds
I
like.
think that actually confuses people too, but.
I hear it, what you're saying as not, everyone look at their risk factor and then decide if they need to wear your guidance.
Masking is just one of a number of options that you can do when you are looking at your personal risk tolerance. But if you think adding that in causes confusion, then fine, you can take it out. I'm not trying to cause confusion.
I just think with the numbers,
Can you just say how it would be written, like how you think it would be written? Just, it wasn't just spoken. So indoor masking, public, the Board of Health advises.
Just keep it clean. We're just gonna have an advisory that, based on the current level of COVID-19 circulating in the community, we advise people to wear masks in crowded indoor spaces or when social distance, 6 feet of social distance is not being maintained. So pretty much what Melissa said with an intro explaining there's rising levels of COVID circulating in the community.
Anything else you want to add, Melissa? Or could you not hear what I was saying?
No, I think that's fine.
Okay. So I will second that motion, or the amended motion, however we want to do that. We'll do this by roll call as we do have some people on the phone. So, Melissa?
Yes.
Alan?
Yes.
Myself, yes. Was there anything else we wanted to discuss related to COVID-19?
I just have some announcements for the public in
Can
case they're not.
Can I just ask a question? So, you know, with the reporting, the question is should we go back to weekly reporting? You know, with the significant change in just that 1 week.
Because right now we're doing the regional reporting, is that?
Now it's
how is
2
it?
weeks, right?
Yeah, it's state numbers per the last 14 days.
Yeah.
Me.
Yeah, I mean, I would be inclined to.
With the week delay from that reporting, to me, it's hard to read that, you know, because if I'm going on, you know, see, oh, I'm hearing all of my friends have COVID, you know, oh, I'd like to see how many are in the town, and then you go on and it's really like, you know, it's just not, it's not an up-to-date number when if I'm looking at that today. And it's pretty, you know, especially with the numbers changing so much.
Yeah, so this was a fair bit of burden, right, to be doing the weekly numbers. When's our next Board of Health meeting? You know, because if we have it switched to weekly, we probably won't change until we have our next meeting.
You have to
June-
set meetings today.
Yeah, we were gonna discuss that when,
Okay.
I was gonna propose June 14th, but the other option was June 2nd, I believe.
Okay.
Was it?
So it could be another month,
Fourth?
you know, for reports. I think it is nice to get the weekly reports. I don't know, what do you feel strongly one way or the other?
I don't feel strongly.
Feedback, reporters, it's only 1834.
Yeah, I don't feel strongly one way or the other.
Can we possibly simplify it a bit?
Yeah, I mean,
Oh, yeah.
what would make,
Okay.
what would make it simpler in terms of you to calculate or do so that it
Well,
relieves some of the
before we
burden?
come back to that, what is the critical information we want to know?
That's it.
Okay,
Yeah.
so to me, how many cases are reported to Maven? Okay, how many cases are reported to the schools?
Do you want the school's numbers on our report?
I think, I think it makes it help our report more useful if they're there.
Okay.
We'll have to look because their dates and our dates don't always sync up. So we're gonna have to either move
Well, I'll have to
ours.
follow their dates, which is more than, they go from Friday to Friday. half
So
days.
we can adjust when we issue the report, but I think we should match their dates, because that way there's a consistent way of reporting in the town. Okay, so, I mean, we've been sending out, we've been posting on Friday, maybe we post it on Monday, I don't care, you know.
Cause I think they do Friday at what, 2 until Friday at,
School end.
yeah, until school ends. They do school Friday at 2 on 1 week and then it ends at 2 and then the next week starts at 2 is the way they do theirs.
You know,
So if we had a
obviously-
report come out on Monday.
We'd have to do it on Monday. We'd have to get in the morning Monday.
Yeah, no, we
get
can
the-
report on
get the numbers.
Tuesday for the prior week. Okay, if you,
Okay.
they're, you know, basically a Friday to Friday, we report on Tuesday.
Okay.
And if there's a Monday holiday, we report on Wednesday.
And so we have two sets of numbers that are coming in and there's some overlap between the two. How important is it for us to indicate what that overlap is? You know, I think mathematical terms like with Venn diagrams, you
Yeah,
know,
yeah,
I've got
yeah.
this circle and then there's some overlap between the two.
Yeah, so like the 17 cases that were on Maven that were also reported at the school would make our total look huge, but when you minus that off the school or off ours, that would bring it back to the regular number, is what you're
Yeah.
saying.
So I mean, almost we need like a total unique cases
Okay.
where we throw
Yeah.
out that
What
number,
if I
but.
took the number of school cases that are in Maven and take them off the total number?
Yeah,
Because we're
Of
already
our town
reporting to the
numbers,
school.
because it's being reported to the schools.
If I follow this, it would be, we have the school number,
Mhm.
and then we have additional cases in town not reported through the school?
No, opposite.
So if the town, if
Well-
the school, you know, I think you're right. So
it
if the
comes out to the
school,
same thing.
Well,
Yeah.
it depends on where you want to stick that overlap,
Right.
which out. And
So
I
if
think
the
to match
school-
consistency, matching the school numbers would be good.
And then,
So, and then we have just additional cases in Westborough.
Oh, yeah, actually, yeah.
Yeah, I don't know if I'd take away from the PCR reported numbers.
Well,
Even
and-
if, I would just mention maybe that there's that overlap, but,
I think it would be confusing too.
I mean, the main reason not to do the overlap is if it's gonna be too much work. But if you're looking at the Maven stuff and you can, I mean, it doesn't take very long to compare the two lists, then it is a more reliable number to say, this is what was reported to the schools, here's additional cases reported through Maven. And if it's too hard to eliminate the duplicates, then I would probably do a spot check once a month, 1 week out of the month. We get a sense of how much overlap there is. So those would be the two options I would consider.
I mean, or we could use past data and say that, you know, about 10% of the cases are, you know, duplicated.
I'm just,
You know,
I'm
just-
afraid that with reporting our numbers, reporting the school numbers, it's just gonna make them larger than they are.
So,
yes, no, I
I mean,
definitely hear you. No,
do you-
I mean,
I-
it just seems a little odd to adjust, you know, like those PCR reported numbers.
We're not adjusting those numbers. What we're doing is we're figuring out how many people in town have been diagnosed with COVID.
Yeah,
So,
And that's the number that we're
That's
most
PCR.
interested in.
yeah, so the way I
No,
looked at it,
not just PCR, Nathan also reports antigen tests
Yeah.
now.
okay,
so I think if Johnny had reported to the school that he has COVID, mom sent him and he got on Maven, we don't wanna count Johnny twice.
Correct. That would make our
That's what I'm
numbers
saying on the overlap is, we don't wanna count him twice, he could have had an AG and a PCR, he's still positive.
That's what we're
wonderful.
finding.
Yes.
Is
We're-
that they're having a positive antigen and the parents are still taking them for their PCR.
Yes.
Yep.
Yeah.
And we want that as one.
One
unit.
person.
One
And I think in
unit.
order to match school numbers, in case somebody's looking at our website and then looking at the school website, it is important that we have the block that says how many were in the school numbers.
Yeah.
And so I think it makes the most sense for ease of understanding if it's how many cases in town other than those ones that are already mentioned in the school. Because I don't think anyone else is looking at Maven to pull out a different number for anything. So I think just, that's gonna make the most sense for people to understand.
I agree.
That makes
Um,
sense.
And then we get back to Alan's point though, is that so much work that it's infeasible, you know?
I'll make it work.
We'll figure it out.
Okay. And I think that I'd like to try it just for the next month.
We'll revisit it at our next meeting.
Yeah, because I don't think we necessarily need it to,
Fire alarm.
going on for,
313.
you know, forever. The goal is
144,
that we give us and the population some insight into where the numbers are, especially right around where we're changing our guidance. And then if it plateaus or something like that, we can certainly cut back, but.
I know, I think we need to discuss whether or not you want me to continue with the surrounding town report, because I think that's gonna end up confusing people, because it is prior weeks rather than current. So do we stop reporting those for now, or do you wanna continue to report both? I find them helpful, I think, but I think this will end up confusing.
They're gonna see we have 120, but then the report says 73, well, where's these extra 50 coming from? Because that one's 2 weeks prior, and this is the one that's
Right.
new.
yeah, I think
I think
that
we
could
can
be
just,
confusing, so maybe while we're doing weekly reporting, we hold off on that, maybe?
yeah, I think we can use it for internal purposes. You can still look at the reports and we can do comparisons with other towns. But
I'll keep our
I
website
agree that
simple.
just one report.
I have a question, because Jen was going over one of the reports. So the report we get from the school, I think actually, are the teachers noted on that too? So we have to find out if they're residents or not, because we don't wanna have non-residents reported, right? I mean, that's gonna skew
That's
our
up to
numbers.
them, because
That's up to you.
if they're in the school system, but yet they don't live here.
And then they're
And
sick, but
I
they're
don't
at
know,
home.
I won't be
So-
able to know that information.
Yeah,
Yeah.
the number of people that fall into that category, you know, I wouldn't imagine that it's more than about, 10 teachers at most, but I could be wrong.
I know there was quite a few on that, and.
So in the last one, there was probably 16 teachers.
Oh, wow.
So
Okay.
I would say we include them
Okay.
because first, it's too hard to pull them out. Secondly, we're looking at what is COVID in the town, and they're in the town,
Okay.
even if they're not residents. We're not trying to do compare, we have to understand, we're not gonna compare to prior reports that were strictly town residents, but we're starting something based on, this week, let's say, and that's the baseline, and we'll see, is it going up or down from that, and not try and compare that. And we can make that clear in the first report. You cannot just take these numbers and compare it to what we've been reporting from the multi-town report or the prior reports that we used to create. That needs to be made explicit. I'm happy to help with that.
I should
And are
say,
you
are you gonna write that
doing
number?
comments?
No, I think that would be great if you could
Are you
have
gonna
an
do your
intro
comments?
paragraph.
What's that?
Still, are you gonna do your comments?
I'm happy to. We'll start. Again, I think it to my somewhat surprise, people look at those comments and I
They
try
do.
and make them as objective as possible and make it easy for people to understand what, at least I consider to be the important trends to pay attention to, good or bad.
Okay.
You've done such a good job with that, that I wanted to continue being your job.
Okay, boss. You're the chair.
No, for some reason you can't, but let us know. But I do think that it's useful to have that. And I
Okay.
think
We'll
with
get,
this
we'll get
first
it back
report-
up when he's on vacation, how's that?
Probably. Good, so you said you now have some announcements?
Oh, yes. So in case people didn't see it on our website or on Facebook, free COVID-19 test kits are available to the public. You can pick them up at the Health Department, Library, and Senior Center during regular business hours. We ask that if you are symptomatic or close contact that are not fully vaccinated, please wear a mask when coming to get your test kits. As a reminder, quarantine is 5 days. The symptom start day is day 0 for those who are not up to date on their vaccines. The isolation is at least 5 days depending on severity, duration of symptoms. For more up-to-date information on Massachusetts guidelines, you can go on mass.gov. We also have a link on our website. There are new treatments available to treat COVID-19. Many people ages 12 and up are now eligible, and supply is currently plentiful in Mass and offered at local hospitals.
Just,
You're
I think
being
it's hard for
Sorry,
people
what did
that,
you
yeah.
say, Jen?
Yeah,
Supplies, what?
We're gonna repeat.
I think you pick up right with the alternate treatments.
There are new treatments available to treat COVID-19. Many people ages 12 and up are now eligible, and supply is currently plentiful in Mass and offered at local hospitals. These therapies need to be started within a short time, some within 5 days from beginning of symptoms. They are offered to people even with mild symptoms to prevent severe illness. If you have recently tested positive, please reach out to your health care provider to discuss these treatments. Massachusetts has also launched on May 4th a new free telehealth program to help residents more easily access COVID-19 treatments. The program allows residents 18 years or older who have tested positive and are experiencing mild to moderate symptoms to have a video consultation to determine if they are eligible for Paxlovid and oral medicine. Residents do not need to have health insurance and treatment is free. If eligible, the provider will send a prescription where the patient is located or arrange for a free overnight delivery to the individual's home. Again, the links are on our website. The FDA
Good, sorry.
The FDA will convene throughout June to discuss Moderna and Pfizer vaccine requests for younger ages. In addition, the FDA is meeting in June to discuss the composition of COVID-19 vaccines and if they should be modified. Please visit our website for further information and links to any of these discussed items.
Thank you.
You're welcome.
Also, I just got an advisory, I didn't find it, where there's a phone number, to call, and maybe that's the one you were just talking about, for treatment. And there's a phone number to call for monoclonal antibody treatment. There's like 5 sites in Massachusetts and they're direct booking through that phone number. So.
If you want to forward that information to me,
Yeah.
I can post that as well under the information on our website.
Yeah, a friend of mine is in between PCPs and called that number for Paxlovid yesterday. And yeah, they called right back. It was impressive. So.
Good. So I think the next thing is deciding what our next meeting would be.
Yep.
We're looking at the month of June.
So I'm okay with the meeting on the 14th. I had some issues that need to be resolved, and I can meet on the 14th if that works for everybody.
Does that work for you, Melissa?
Yes, that works better than the 7th.
Okay.
Good, and that would be 5:30, would that be here because it's an off week, or would that be somewhere else? Or we have to figure it out?
I'll look into it.
Okay,
I'll do that tomorrow.
We're gonna
Excellent.
give her as much work as possible until August.
Yeah, we're gonna book the next 3 years of meetings, so.
Thank you.
Actually, I just realized I have a doctor's appointment in Boston at 2:30. What are the chances?
And that's my
What
problem.
what day would be better for you, Melissa?
What? I'm
I
sorry.
said, what day would be better for you?
So is 7th out for you, Ellen?
No?
Well,
Oh,
I
it's
unfortunately have a doctor's appointment in Boston on the 7th.
I think I'm
Did they just switch
making
and
it
copy?
back.
I don't think so, not with,
And you said you couldn't do the
Traffic.
21st either, right?
I can't do the 21st.
No, I think I should be able to make it back.
I personally don't think you will, because I can't ask you to walk in, so I didn't.
Let me ask you this, Melissa.
No, it's children's, and I'm pretty sure this guy is very on time.
Okay,
We can also
And we
do
could
Colin
always-
as
I can
well.
always send the husband
Yeah.
if I have to. so.
again, if you have to pull over and call in, well, the two of us will be here.
Yeah, no, I'll figure it out. Thanks.
We'll set up a Zoom if,
Just in case.
Sounds good.
Yep.
All right,
So 14th then, that we decided?
Yep.
Good.
Yeah, it's not for me, it's for my son, so you can always send him alone too. He's old enough, but we'll see.
No one likes to do that, no one likes to do that.
Yeah.
I
Boss,
move-
we have
so I'm gonna make a motion to adjourn.
I second it. All in favor?
Roll call.
Oh, yes. Dr. Meyer?
You agree to adjourn?
Yes.
Okay. Dr. Ehrlich?
Yes.
Dr. Walsh? Yes.
Okay.
Thank you, everyone. Appreciate
Thank
you
you.
coming in.